COVID-19 cases are rising here and there, states opening up anyway. Todd Furniss on the line here with us this morning. Over 25 years of global experience in private equity consulting and operations as a senior level executive in a variety of industries. Todd, what do you think? I'm one of these people that said we should have never closed down in the first place, but your thoughts?
Well, we've been through a lot as a nation. First of all, thank you so much for having me this morning.
Sure.
I appreciate it. We've been through a lot as a nation, and we're trying to learn as we go for something that we haven't had really a lot of experience with. On the one hand, I think that the disease has been so politicized that people are anxious about what the truth really is, and they're finding comfort in the fact that we have a vaccine that's ready, available, and has been rolled out reasonably well. And we're in a situation now where a lot of people have been vaccinated. I think people just genuinely feel like, hey, the end is near in terms of the end of the pandemic, and it's time to move on.
Well, I was out in downtown near Savannah over the weekend, and I'm telling you, you wouldn't know there'd been a pandemic. The place was packed.
That's a good sign. I kind of, it used to be that we'd get all fussy when we got into traffic. Now I rejoice. I say, hey, this is fantastic, man. I am so excited for our nation's economy that we have traffic now.
Isn't that the truth? Todd Furniss with us about COVID-19 cases. We're letting the guard down too early because, Todd, they keep, like you said, it's been politicized so much. They keep moving the goalposts. I think Anthony Fauci has suddenly, he thinks he's either emperor or president or something because first of all, he said, don't wear a mask. We don't need masks. Masks don't help. Then he said, okay, well, you better start wearing a mask. Now you have to wear 2. When's it going to be 3? And we have these mandates here. Said where we're gonna extend the mandate till June the 6th, and about June the 4th will come along, and they'll say we're going to extend the mandate till August the 12th. On it goes. It's like it never ends.
Well, I think there are lots of folks now with a vested economic interest in the continuation of the restrictions, and that's problematic in and of itself. Think about all the folks who sell those little adhesive discs that go on the floors that say you got to stay 6 feet apart, or the folks who sell the plexiglass dividers. And my question is, what's going to be the economic catalyst or the medical catalyst to remove those things? My hunch is we're going to have those discs on the floors for 10 years. But I think the bigger, and you saw this quite honestly with the President's State of the Union speech when he said, hey, if we're lucky and everybody does exactly what I tell you, then we might be able to gather in small groups with family for the 4th of July. To me, he was laying the predicate for saying that's not really going to happen. And by the way, I told you so in my State of the Union speech. So I get nervous about that. I think people have to take individual responsibility for their own actions and get out there and do the right thing by taking care of themselves and being in the best health position as is possible. And to me, as I wrote in my book, that includes getting to the primary care physician, making sure you get checkups regularly, making sure you know who your primary care physician's name is, and you have a longitudinal relationship with him or her.
We're heavily into shameless self-promotion, Todd. The book is The 60% Solution, Rethinking Healthcare.
Yes.
Tell us about it.
Well, I put together a 5-point plan on how to correct the industry, really by reintroducing the notion of consumerism, individual responsibility back into the mix, and saying, hey, we've got too many hands in the pie when it comes to your health care, meaning we've transformed health insurance, which only about 10% of Americans had prior to FDR, to a place where we've got a layaway plan for health. And so that takes away the need for individuals to have personal responsibility for what they need to do to be healthy. And so we have critical problems on a national basis right now, like obesity and a litany of others, which are very, very problematic and really causing great strains, not only on the individual, but actually on the healthcare system itself. So I think we need to get back to this focus on let's do what we can. Let's take personal responsibility. Let's inject consumerism into the model. Let's pay for our stuff directly to the extent we can. And let's make cash available to individuals so they have the cash to pay directly for their healthcare. Think about it. If you go into a healthcare facility and you say, hey, I'll pay cash on the barrelhead, more often than not, you get a 25 to a 75% discount on the cost of those services. Mm-hmm. But the reality is you don't get the benefit of that, so you're never going to do it. Your only concern is what's your copay. So we've got to change that model back to something where there's a direct correlation between the patient and the provider.
Well, Todd, we've had those clinics here. By the way, thank you for being honest about the 60% solution. Most people come out with their book said, "This is it. You buy my book, and the world is going to be rosy. Everything will be coming up roses." But you only have the 60% solution of rethinking healthcare. Good on you.
Well, thank you. My goal is if you can fix the folks who are on private insurance, and meaning if you can help them and have a better business model for all this. And as you know, I'm a business guy.
Mm-hmm.
I'm looking at business models and cash flows and the way things really work from a financial perspective. If you can fix that, which is really a problem right now, that you can solve it for most of the nation. You can even beneficially affect those on Medicaid and Medicare. So 60% of the population, roughly, is primarily looking to their private insurance through their employer.
Well, Todd, we have those clinics here. It's cash on the barrelhead. That's it. No, they don't take insurance, just cash. And the costs are surprisingly low. It's like $50 for a visit, or maybe it might be more depending on whether they have to do an X-ray or something of that nature. But Sean Hannity for years has been taking these doctors that formed that consortium when they came up with this Obamacare 10 or 12 years ago. And they formed a consortium, and for $60 or $50 or $60 a month, you can hit this family care. And takes care of everything, and they've negotiated with the pharmaceutical industries to get like 80 to 90% off your pharmaceuticals, and it works like a charm. And Congress just sort of sits there and go, do.
Well, can you imagine putting a clause into a bill that says that the government can't, the government, who's the largest purchaser of healthcare services through Medicaid and Medicare in the nation, says that the government can't directly negotiate prices with big pharma? That doesn't make any walking around sense, as we say in Texas. So what happened was, under the prior president, President Trump, we changed all that, and he put an executive order that changed the pricing you got from big pharma. He also did a whole lot of other things that are terrific for the industry, like pricing transparency and telemedicine and a number of other things, which were groundbreaking in many regards by allowing some of the old traditional licensing issues that got in the way of providing health care across state lines to be at least temporarily suspended.
Well, see, Todd, like you, he was a businessman. He wanted to end the problem, not exacerbate it or keep it going, and to put himself up for re-election like these other guys.
Well, and my goal is certainly not to run for office, but my goal is to really help as many Americans get the lowest cost health care possible at the highest quality. And that's the thing. We have terrific health care in the United States. Really, really fantastic providers, and our doctors and our nurses are so mission-oriented. They've got monster hearts. I mean, just so much compassion.
Oh, yeah.
And what happens is all the bureaucracy just plain all gets in the way.
Exactly. Yeah, and that's the hard part about it. And these people are staying in the industry despite the fact that the government keeps trying to mess it up. Todd, thank you so much. Where do we go for more information besides your book?
Well, you can go to the book, the60percentsolution.com, or you can go to rethink.healthcare.
Rethink.healthcare. Sure appreciate it, Todd. Thanks for getting up early with us.
Thanks so much for having me.
Yes, sir.